Okay, let's move on. COVID. I want to try and give you guys as complete an update as possible here on Omicron. We were looking at some of the data. It's a bit squirrely. So we did see a drop in cases in South Africa, but there's also over the weekend. There's also a report around data processing there in terms of how Omicron is working in that country. Britain had its very first known death, the first global death actually, of Omicron, which, you know, if anything, that's actually a plus. It's the first one. And we known about this virus or the new variant for almost 2 weeks. But it is leading to a lot of questions around boosters, around how we deal with this as a society, given the fact that from what we currently know, yes, Omicron is much more likely to lead to a breakthrough case whenever you're vaccinated. I'm talking specifically about 2 doses of the normal vaccine, but the case, seemed to be generally, so far, milder and less severe in terms of how they manifest in patients. Take that with a grain of salt. In the United States, we're much more obese and old than a lot of the general population, in the worldwide. And so if it would be worse anywhere, it would probably be here. Still hasn't manifested yet. We don't know. Yet again, though, it's leading to a huge discussion around booster shots because, let's put this on the screen, the Pfizer CEO has now come out and said that a fourth vaccine shot may eventually be needed. Now, I want to be clear in about how they're saying it and describing it now. He says, quote, "I think we will need the 4th dose," pointing to the previous timeline of 12 months. But he says, quote, "With Omicron, we need to wait and see because we have very little information. We may need it faster." And I think once again that this is playing into, Krystal, the fact that there is not enough critical discussion around these boosters and the obvious profit incentive that the Pfizer CEO has to say, oh, yeah, we're going to need a 4th shot. I mean, it was not very long ago that you were considered a conspiracy theorist to say that, what are you going to get, your 4th jab or your 5th jab or something? And people were like, you're crazy. All you need is 2. Well, I mean, you have the CEO of the company already saying it, Israel already authorizing that shot. Some people I know, you've gotten a booster shot, others have as well. The data out there, it's a very small study out of Israel showing that it seems to hold up. So, take that into account in terms of making your own decisions. But it just comes down to, at what point is this going to become government policy? Because we've seen also the vaccine mandate out of New York City where all private employees there in all 5 boroughs are going to be required to be vaccinated. We don't know yet if new Mayor Adams is going to put that policy actually into effect, but for right now, it's on the books, and it seems to be the case. Will they try to change the new standard of fully vaccinated to 3 or 4 shots? I mean, that could impact the way that if you're going to dine in this state of California, in New York, perhaps even air travel, not necessarily to get on the plane, but to get off the plane in Europe, South America, and elsewhere where they require vaccination. I just think that, feeding into this, look, sure, it probably contributes to vaccine hesitancy, but it just leads to the point of when is enough? What is the level at which it's okay?
I'm not even gonna say full stop that there won't be a time when it's needed and when it's important and when we should encourage, people to go out and get another shot. But their own data that they just released shows that a 3rd dose led to similar levels of antibodies against Omicron as 2 doses had against the original virus, which led to strong protection. So, of course, they get out ahead of their skis because they see, in the cartoons where their eyes become dollar signs, that's them right now.
Yes, literally.
And so, literally them and Moderna, same thing, coming out and making similar, this is, the CNBC dude was like, this is an annuity for you. This is great. And people can get a shot every year. And you can see the stock prices soaring. I mean, it's just absolutely grotesque. We shouldn't be listening to what people with a direct financial interest in additional shots, their opinion to me is worse than irrelevant.
Oh, yeah.
Show me the data, show me the independent studies, not the industry-funded ones, and let's make an intelligent decision from there. Because you're right, when, it's very easy to conflate the financial incentive they have to, let's have a 3rd shot, let's have a 4th shot, let's have a 5th shot, let's have a new formulation that people have to get every year. It's very easy to use that clear financial incentive they have to then fuel conspiracy theories about the vaccines, which are not true.
Right.
So that's the issue here. You know, I actually listened to, Brianna had a podcast where she had Dave Weigel on to talk about sort of the politics of COVID and that sort of stuff. And she had Dr. Abdul Sayed on, who we had on the show recently as well. And he was saying the line he wanted to draw was you should separate out their sort of business incentives from the science that these drug companies do. And he's saying, like, you can trust the science, but you can't trust the business incentives. And I wish it were that clean and simple.
Yeah,
because
exactly.
When you look at, I mean, they've been caught a couple times by the FDA
the Merck pill is a
trying to
perfect
juice
example.
their numbers. Johnson & Johnson vaccine, their booster shot, they, used some techniques that the FDA found sort of suspect to show a higher response than what actually was there. The Merck pill is a perfect example. Or you can think back to things like, the opioid crisis, which a key part of how that was fueled was because the maker of Oxy was able, through regulatory capture, to get this line inserted into their disclosure that said it's believed to be non-habit forming. Anyone looking at that would think that was based on science because it's government-approved language on medication. But in reality, there was no good science to back that up. So this just gets to the core principle that when you have financial incentives at the center of your healthcare system, it leads to terrible results. And the reality is that 2 shots, yes, there are a lot of breakthrough infections, actually, fairly significant amount of breakthrough infections, especially over time. That level of immunity does wane, but they continue to be very effective protecting against severe hospitalization and death. If you are someone who is at higher risk, especially if you're elderly, it seems like a booster shot makes a lot of sense. If you're anybody else and you just don't want to get COVID and you want to be, forward thinking about helping to stop the spread so that you don't have more of these variants germinating, then it makes sense for you to get the booster shot as well. But I don't know why we're listening to these people who have a direct financial incentive in pushing things in a certain direction.
I completely agree. And this is the problem, is there's no real rational discussion. And I honestly have lost so much faith in the CDC and in the FDA in the discussion around all of this because there's no consideration of natural immunity whenever they discuss the need for a booster or not. I can only speak from this is the only data we have in terms of people I know who've had COVID and who did get the booster shot, did have a severe reaction. I'm not saying that they got, myocarditis or whatever, but they were sick for like 4 or 5 days. That's a long time. And the question was, did they even need it in the first place in terms of warding off Omicron or more? And in terms of the data that we have, at least in the countries that do recognize natural immunity, it is quite robust, especially if you combine it with vaccine immunity. Of course, it's nice in my case because that's what I have. But what it comes down to is that whenever we're pushing things both financially and then seemingly ideologically, it just leads to a total lack of trust and faith within the system. And it's like you said, look, this all continues to embrace a general COVID zero mindset, which is that boosters and all that is probably gonna stay for the immunocompromised and the elderly. And especially if you're obese, like if you are, if your BMI or whatever is obese, you have comorbidities, diabetes, immunocompromised, all those things, you probably should get a booster every year in order to make sure, because those variants are just gonna keep on coming. COVID is always gonna be circulating, and it will always be a way higher risk to you than it is to the general population. For the general population, if you have 2 doses of the vaccine, even now currently, 6, 7, 8 months or whatever out, yes, your ability in order to prevent breakthrough infection, it's diminished quite significantly. We don't actually know what the number is on that. And if you haven't had COVID yet, maybe if you really don't want to get a booster, all of that doesn't seem to be much of a problem. If you had some, mix of the natural immunity with the shot, or vice versa, and all of that, then it's a little bit up in the air. And it also depends on your general physical health, on your condition, and all of that. The lack of the nuance in the policy, and that's where, I'm really scared, is where this all comes into play. Because we were talking, hopefully we'll cover it, in the future on the show. We still have a situation where kids are eating outside, like in the cold. You know, I mean, this is totally nuts. And it's like you see this mentality of COVID zero and completely unscientific measures that get embraced in public policy and pushed for who knows how long. I mean, it's been 21 months, okay, since COVID has come. I mean, it's been a long time, and there ain't that much not necessarily of a change in the way that this is manifesting itself, and the decline of trust in our institutions, and especially combining here with the people who have major profit incentives to push us forever, it's very detrimental to public health.
Look, it's not an accident that we have a for-profit healthcare system here that a lot of people are disconnected from and feel, you know, that they can't trust, and oftentimes for good reason. And that we have higher rates of vaccine hesitancy here than other developed countries. Those two things, I mean, there's a direct correlation there. And as you see, like, you know, people who are more skeptical of government, who have oftentimes good reasons both in their own lives and historically to be skeptical of the healthcare system, have been the most resistant. So again, that profit motive at the center of our healthcare system, whether it's hospitals or pharmaceutical companies or health insurers, it destroys trust and it leads to worse public health outcomes overall, which we can see not just with vaccine hesitancy, but with our public health data at large. I mean, it's part of why we are less healthy and have more chronic conditions and more obesity and all of those things. So again, I really don't care to hear from the Pfizer CEO about how many shots we may need and when. I'm gonna wait to see some data that was not provided for by Pfizer, or just, I mean, at this point, it actually goes against the Pfizer data, and it's just like the CEO wish casting even more millions for himself.
Yeah,
so
that's right.
There you go.
All right.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.